Hello and welcome to ChurchTherapy.com's Pastor Training Videos. I'm Kristen Kinsevich, licensed mental health counselor on staff at East Coast International Church in Lynn, Massachusetts. Today we're going to be talking about anxiety disorders, and this is a really common question that I get about how worry and anxiety can possibly go together with the Christian life. Because obviously we hear verses like, cast all your cares on God for He cares for you, and don't be anxious about anything. And so then when you have someone who seems continually anxious, often we try to find some spiritual answers for that. And we try to say, okay, let's work through those verses a little bit more. Let's see in what ways are you not trusting God enough and those kinds of things. And I think what we need to really realize is that when we're talking about a clinical anxiety disorder, there are real physical, biological problems happening that go far beyond the spectrum of just a spiritual problem that would involve trusting God more. Now, obviously, as a pastor, you're not going to be really trained in assessing what is an anxiety disorder and what is maybe an area where someone does need to trust in a certain way. I can give you a few little pointers on that. Not that I want you to go around diagnosing anxiety disorders, but just to kind of help you in your process as you meet with people to kind of be able to recognize what are some of those symptoms. So you want to look at the frequency, intensity, and duration of any symptom. How often is this happening? How long does it last? How intense is the symptom? You know, if someone is going through something in their life, maybe their kid is about to go off to college and they're worrying about their child's future. That kind of situation is a temporary one. There's a specific cause. They understand why. And in that situation, we might say, okay, what does it look like to trust God with your child's life? And that might be a spiritual issue to work out. Versus someone who finds themselves worrying about everything kind of pervasively, you know, when they watch the news, when they, you know, if they're not with their family, they're worried something bad is going to happen to their family. They're worried that across a variety of areas, and the intensity of that worry persists, and it's something that goes for a long time across their life, not just kind of a one-time circumstantial thing. Certainly with panic attacks, that can sometimes be circumstantial. It's not like people necessarily have panic attacks their whole lives if they go through a season of that. But some of these mental illnesses, we have to remember, are not necessarily severe and chronic. Some of them are mild or moderate, and they are for a period of time, maybe a year or a few months. So we have to recognize that there are some physical things that happen when anxiety disorders hit. So there's different types, and I wanted to just mention that in my books, I have talked about anxiety disorders. In this one, On Edge, Mental Illness in the Christian Context, there is a chapter specifically about anxiety and kind of worry. What does it mean for me to be a Christian if I worry all the time? So that is something you can definitely check out. And then also I talk about anxiety, anxious thoughts in Emotional Traps, Finding Freedom in Everyday Life. These books are available on Amazon. You can find them also on the tab on my website, ChurchTherapy.com. If you click on books, it'll take you to the links there. So definitely check those out. There's tons more information in those books that can help you as you try to work with people who may be, you know, exhibiting some of these symptoms and you're not sure what to do. Now let me talk through some of the types of anxiety, because not all anxiety is the same. Certainly phobias are common, and these are going to be a kind of anxiety that is probably less disruptive to a person's life unless it's something they have to face every single day. So let's say someone has a phobia of airplanes. Well, generally they can just drive places, maybe avoid long distance travel. So they may be functioning pretty well, except for if they have to go on an airplane. And so that might be the time where their symptoms are triggered. And again, it's really important to remember anxiety is not rational. So you can't talk a person out of it. Of course, we could have all kinds of statistics, let's say, about why airplanes are safer than cars or different things. And we often like to spout these out when people are feeling anxious. It really doesn't help, because ultimately in anxiety, most of the time people understand that their fears are irrational and they wish they could change them, but it feels like there's nothing they can do about it. It just, they can't get rid of the physical feeling. Other types of phobias would be certainly things like snakes or maybe blood or hospitals, needles, that kind of grouping. And other things as well, some things that are a little bit more pervasive, Certainly with agoraphobia, leaving the house would be difficult. Now you're getting into someone whose functioning is really declined because of this phobia. So again, you're looking at the frequency, intensity, and duration of these things to see exactly how intense of a treatment response they would really need. Panic, I mentioned earlier, panic attacks are another form of anxiety. And these can hit in various seasons of life, sometimes without warning. Sometimes people feel like they're having a heart attack or they're going to die. They feel really intense. Panic attack really never lasts more than an hour, and that would be a very long one. Sometimes it's only a few minutes and then it goes away. So that's just helpful information to know if you're talking with someone and they've experienced this, to encourage them. Then there's social anxiety, and that certainly obviously comes up in social settings. Often it's driven by a fear of embarrassment or what other people are thinking about them. And these are the kind of people that are really going to struggle when, maybe in the morning service you have a greeting time. You say, okay, go shake 15 people's hands. Those are the people that are probably going to sit down and stay in their seats during that time. Not that all of them have social anxiety, but certainly, our church context sometimes is a trigger, and we need to recognize that. When people have experienced something or are going through some anxiety, different things can trigger those symptoms. And so we need to pay attention to what are the ways that we're kind of gearing church towards people who aren't struggling. What are some ways we can make it easier for people who aren't struggling? So that's something to keep in mind. Certainly PTSD, post-traumatic stress disorder, is another form of anxiety. That's obviously going to be linked to a trauma. And when a trauma is experienced and then they have immediate anxiety symptoms, that's an acute stress disorder, so that's right away. It may not develop into post-traumatic stress, or it could. So those are some things you're going to see if someone experiences a trauma right there, and then you're maybe talking with them soon after the trauma. You might see them experiencing the acute stress. And then generalized anxiety disorder is another one where that's, again, more of the pervasive worry across a variety of areas, and it really stops people from feeling free to do things sometimes, or their response seems like a fear response a lot of times. So again, the point here is not for you to be able to diagnose these things, but really to be able to promote treatment. So one of the best things you can do as a pastor is to acknowledge the physical, biological things that are happening in the body, and really help people have language for that. So it gives them permission to say, maybe I need some help with this. Certainly counseling, you don't necessarily have to race to medication either. Things like relaxation exercises, mindfulness, those kinds of things that counselors can help with can really help reduce the symptoms of anxiety that people are experiencing. Coping skills, self-care, all of those things can really help. Medication should be really a last resort in the case of anxiety, because unfortunately some of the quick-acting anxiety medications that we have are addictive or habit-forming, and so I certainly don't push people to go explore that with their doctor right away before they've tried things like exercise and self-care and relaxation. So those are some things to keep in mind. But really not making it about how their faith is doing, or it's a spiritual issue, or they just need to trust God more. Those are things that ultimately really fail because it's not within their control to do. If they could do those things, they would have already done them. Most of the time people would like relief from these symptoms, and so those kinds of spiritual answers are really unhelpful and often harmful. The kind of try harder mentality, it really never works. And it makes people feel like there aren't options for getting any better. But when we treat this the same way we would treat if someone had a persistent cough, let's say, and you would encourage them to go talk to their doctor or go get help, maybe get a breathing treatment or something like that, those kinds of things are just the same as when we're talking about an anxiety disorder. You certainly wouldn't look at someone with an inhaler and say, wow, they really are just not trusting God enough. So when someone is experiencing panic attacks or generalized anxiety or any of these other things I've mentioned, it's really important not to send a message that there's something wrong with their faith, but to encourage them to get help, that there is help out there, and that these things are really treatable and don't necessarily require medication. So we're not even necessarily saying that that's a quick fix, but there are coping skills that can really help. I hope that's been helpful. Go ahead and check out churchtherapy.com to see some older videos that I posted, and I hope to see you next time. Take care.